Hi everyone, my name is Kimmery Norman. Today I'll be presenting on lung cancer, focusing on its burden, major risk factors, and why it remains such an important public health issue. Lung cancer continues to be the leading cause of cancer-related death worldwide, despite advances in screening, even in diagnosis and treatment. This presentation is based on my descriptive disease paper, and it will look at lung cancer from a public health perspective, including epidemiology, risk factors, clinical features, and prevention strategies. Lung cancer occurs when abnormal cells grow uncontrollably in lung tissue, interfering with normal breathing and oxygen exchange. There are two main types: non-small cell lung cancer, or NSCLC. It accounts for about 85% of cases and tends to grow more slowly. Small cell lung cancer, also known as SCLC, is less common but more aggressive and strongly is associated with smoking. One of the biggest challenges with lung cancer is that early stages often have few or no symptoms, which is why many people are diagnosed late. The anatomy of the lungs. So understanding lung anatomy helps explain why lung cancer spreads so easily. Air enters through the trachea, moves into the bronchi and bronchioles, and then ends in the alveoles. So this is where our oxygen exchange occurs. The lungs have a very rich blood, and it has very rich blood and lymphatic supply. So while this is essentially essential for oxygen delivery, it also allows cancer cells to spread more quickly to other parts of the body. Because the lungs are constantly exposed to toxins like cigarette smoke, pollution, and radon, they're especially vulnerable to cancer to develop. Epidemiology of lung cancer. This slide highlights the epidemiology of lung cancer. According to the American Cancer Society, lung cancer remains the leading cause of cancer-related deaths worldwide, and accounting for about 1 in 5 cancer deaths. In the United States alone, there are roughly about 234,000 new cases each year and about 125,000 deaths annually. Although these rates have declined slowly due to reduction in smoking, and lung cancer still places a major burden on older adults and remains a significant public health concern. Causes and risk factors of lung cancer. The CDC identifies that smoking remains the most significant risk factors for lung cancer, responsible for about 80 to 90% of cases. Tobacco smoke contains multiple carcinogens that directly damage lung tissue and DNA. So this is direct. However, lung cancer is not limited to smokers. Radon exposure is the leading cause among non-smokers. and long-term exposure to air pollution and occupational hazards like asbestos also significantly increase risk. These risk factors show that lung cancer is influenced not only by individual behavior, but also by environmental and occupational conditions, which make it an important public health issue. And as you see in the picture, you see the ones that it's of someone's behavior, and then it's of just environmental and occupational. Signs and symptoms of lung cancer. According to the CDC, one of the biggest public health challenges with lung cancer is that early stages often cause few or no symptoms. This is a major reason why many cases are diagnosed at advanced stages. When symptoms do appear, they often are non-specific and they can be mistaken for like a common respiratory condition. Common symptoms include a persistent cough, chest pains, shortness of breath, fatigue, unexplained weight loss, and also even coughing up blood. Because these symptoms overlap with conditions like bronchitis or asthma, people may delay seeking care. And it often contributes to late detection and poor health outcomes because of this. From a public health perspective, this highlights the importance of screening in high-risk populations rather than waiting for symptoms just to appear. Screening and early detection for lung cancer. According to the ACS, lung cancer is often asymptomatic in its early stages, and screening plays a critical role in reducing that mortality. Research shows that low-dose computed tomography, or LDCT, is currently the most effective screening method for individuals at high risk, particularly long-term smokers and former smokers. Large clinical trials have shown that LDCT screenings can reduce lung cancer mortality by identifying cancer early when treatment is more effective. Despite this evidence, screening rates remain low to barriers such as limited access or lack of awareness, stigma related to smoking histories, and also medical mistrust. So from a public health perspective, increasing screening uptake requires not only policy support, but also education, culturally sensitive outreach, and patient navigation programs will be very helpful in this case. The public health importance of lung cancer. Lung cancer is, CDC brings out, and research shows that lung cancer is one of the most preventable cancers, yet it remains one of the deadliest. Tobacco control is still the most effective prevention strategy. Policies like smoke-free laws, taxation, and access to cessation programs that have significantly reduced smoking rates, which has contributed to declining lung cancer incidence. Screening also plays a major role in this. Low dose CT screening has been shown to reduce lung cancer mortality among high risk individuals. But many eligible people are not being screened. And there are also clear disparities. Black Americans and people with lower income are more likely to be diagnosed at later stages and have lower survival rates, often due to barriers in access to screening, follow-up care, and environmental exposures. So this shows how lung cancer is not just a medical issue, but a public health issue shaped by policy, access, and social conditions. Before I finish, I included a short knowledge check to reinforce some of these key points from this presentation. Let's see how you do. Lung cancer is the leading cause of cancer-related death worldwide. Which of the following is the leading cause of lung cancer? Which group is most likely to benefit from lung cancer screening? And low-dose CT scans are primarily used for. Let's see how you do. Typo, sorry. So lung cancer is the leading cause of cancer death. That's true. And then, which of the following is leading cause of lung cancer? Cigarette smoking. Which group is most likely to benefit from lung cancer screening? Long-term smokers over the age of 50. And low-dose CT scans are primarily used for screening risk individual, high-risk individuals early. So to summarize, lung cancer remains the leading cause of death, and largely because it's often detected late. Smoking is still the biggest risk factor, but screening with low-dose CT scans have been slow to reduce mortality among high-risk populations. And then last but not least, despite all of this, screening rates remain low, which bring us to the discussion questions about the barriers like access and awareness. These are my references that I used: American Cancer Society, American Lung Association, Centers for Disease Control, CT screening. And of course, thank you for your time.